Welcome back. It has become common for the biggest celebrities in the world to share pretty much everything with their fans, their successes, their failures, and even their health diagnoses. In the past week, Toby Keith shared that he had stomach cancer, and Justin Bieber revealed that half of his face has been paralyzed by Ramsay-Hunt syndrome. What's behind the decision to put it all out there? Protect themselves from gossip and speculation? Or maybe raise awareness and money for research to these sometimes fatal illnesses? I want to bring in Dr. Andrew Ordon. He is a board-certified plastic surgeon, and you know him as one of the co-hosts of the syndicated daytime series, The Doctors. And Roger Neal is an expert in celebrity PR and crisis management and owner of the Neal public relations firm. Welcome to both of you. Okay, Roger, I'm going to start with you about the PR of it all, because some people are, pretty suspect about why somebody would come out and say, I've got this or I've got that. But if you had one of these clients, and you do have these clients, and they come to you and say, I have cancer, or I have lupus, or I have MS, or, I have this very unique condition that Justin Bieber has, what would you advise them to do? Can Roger hear me? Darn, I think,
hey, I hear you.
I think Roger doesn't have the mic. You
can
hear me now?
Thank you for having me. I can hear you. Thank you for having me.
Okay, so I think your IFB was dead when I asked you the question, so I'll just re-ask it quickly. If you had one of these big clients, and I know you do have these big clients, what do you say to them if they come to you and say, I have a terrible disease, what should I do?
Well, I think that because of reality television, I think we're so used to seeing every celebrity's life out there in the public. And I think they can help a lot of people who might be going through the same thing. If your favorite star is going through some kind of medical situation, and it could give you the courage to step up and maybe get some help that you need. So I don't think it's such a bad thing for stars to talk about what they're going through, because, look, they're just like the rest of us. They're real people just like us. They go through the same things we go through. And I think it humanizes them a lot as well. So I don't think it's a bad thing. I think it's an okay thing.
So, Dr. Ordon, in 2015, Selena Gomez came out publicly and announced that she was in treatment for lupus. And at the time, her concern was that she was in a rehab facility for lupus and was concerned that the public might out her as being in a rehab for, addiction of some kind. And that takes me back to 1992, when Annette Funicello announced to the world that she had MS, multiple sclerosis. She was worried because she was slurring her words and falling down that people might think that she was drunk all the time. So they had those different reasons for saying why they had these illnesses. But what was the net effect of at least those two coming out publicly with their illnesses?
Well, number one, it's great to be back, Ashleigh. Always a pleasure to be on your show. And, everybody is different. I deal with patients every day. Some are very private. They don't want to share anything about their health, even with their family members. They're very private. But when you get into celebrities, it's a whole different ball of wax. And what is the motivation? Well, in this case, with both of these singers, I think the motivation is to set the record straight. I mean, you look at Justin Bieber, half of his face is paralyzed. His fans are going to look at him and go, wow, did he have a stroke? Does he have a brain tumor? What's the matter with him? And, to dispel all that craziness that's going to go out there on social media and everywhere else, he came forward and was very honest, and I think he did the right thing. And, having done the Doctor's TV show for 14 seasons, we have celebrities come on the show all the time. Most of them are going to discuss a health medical issue. All of them have a little bit of a different motivation to do it. Do they in fact have a problem? Does a family member have a problem? Are they involved with a charity, or is it strictly just a public service announcement? So it's all of the above. Many different reasons. Where I want to back off is when people are doing it to seek attention and take advantage of it, whether it's to gain sympathy, which they think is going to help them.
And I think that's fair. Yeah. Okay, Roger, I'm going to list off a couple of people. And when you start to see the list, it is pretty extraordinary how many people have come out publicly with their different ailments. And let me start with Cara Delevingne. She showed publicly her psoriasis on her skin when she was at the Met Gala this year. And the cameras, zeroed right in on this beautiful model who was not afraid to show that. And there you go. That's the example right there. And then Selma Blair, we all know Selma. She walks the red carpet and she carries a cane for her MS. And she has been doing that on every red carpet. She goes through any step and repeat, any photo session, and she is not afraid to show that cane and be public about her MS. Sarah Hyland from Modern Family and Selena Gomez, I mentioned, as well as the comedian George Lopez, they've all shared updates about their kidney transplants very publicly. Ben Stiller has shared information about his prostate cancer diagnosis. He advocates for people to get screenings. And then I'm going to list off all of these women: Cynthia Nixon, Melissa Etheridge, Joan London, Wanda Sykes, Tig Notaro. They've all discussed their breast cancer diagnoses very publicly and, have been able to, raise a lot of awareness. So, Roger, this can only be looked at as a good thing when more people have eyeballs on things that they should be worried about themselves and maybe should open their wallets for.
Well, I think that it's good that they're doing this. I mean, I think they're helping so many people out there who may be going through the same thing, like I said before. I don't think it's a bad thing. I agree with what the doctor said. If they're doing it just to seek attention, and then it's the wrong reason. But if they're doing it because they want to help people, and maybe it helps them, by the way. By the way, when you have an illness, it's a scary thing. So maybe they need the love back from the fans because they're going through, and again, they're human, just like you and I. They're the same as you and I. So they get scared like we do. If you have an illness, you may get concerned about it. So I think it helps them as much as it helps other people as well. So again, I don't think it's bad for their brand. I don't think it's bad for their brand at all.
When it comes to helping, listen, when it comes to helping others, Dr. Ordon, listen to this list of celebrities who have gone even further and started their own charities. Michael J. Fox has raised $1 billion for the Michael J. Fox Foundation for Parkinson's research. Lance Armstrong, say what you will about him. I don't like him, but look what he's raised for Livestrong, for cancer research, $500 million. And then the Dana and Christopher Reeve Foundation has raised $120 million for research as well for his paralysis that he suffered through. So I've only got a couple seconds left, but that's really brave to come out and then dedicate your life to it.
Not to be so open to share what they're going through with so many other people that are going through the same thing. Roger's point was excellent, that you're making so many people feel better about themselves dealing with their disease process, and then to go even further to start a charity and try to find a cure. I mean, that's over the top. These people are saints.
Yeah. I agree. I feel the same way. Dr. Andrew Ordon, good to see you. Thanks for coming on. Roger, Neal, as always, love seeing you. Thank you, gentlemen. Appreciate it. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.